Dr. Gregory is starting his first day working at a pain management clinic. He's discussing his first patient of the day with Helen, a nurse who has been with the clinic for 10 years.
Good morning, Helen. How are you?
Fine, good morning.
I see our first patient is Miss Jones. She's here today for a steroid injection to control her knee pain. Can you show me where you keep all the supplies?
Sure. Why don't you tell me what you need and I'll get the room set up for you. I can also draw up the medications.
Oh, that's okay. I can draw them up myself during the procedure. I'll just need a vial of lidocaine, a vial of Kinalog, a couple of needles, and one syringe. I already have the drape and skin prep.
One syringe? Aren't you giving 2 injections?
Yes, but after I inject the lidocaine, I'll just change the needle and draw up the Kinalog.
I'm sorry, but I'm going to have to stop you right there. First, we use multi-dose vials of lidocaine and Kinalog. Multi-dose vials must be drawn up in our medication prep area, and they can't enter the patient treatment area unless we're dedicating them to that patient and discarding them at the end of the procedure. And more importantly, reusing a syringe to access a medication vial is not safe, even if you change the needle. Besides, changing the needle would only place you at an unnecessary risk of a needle stick injury.
Well, I'll make sure not to aspirate to avoid any contamination of the syringe.
That won't prevent contamination. As you give the injection, blood can travel up the needle into the syringe, even if you don't aspirate. If you reuse that syringe with or without the same needle, you will contaminate the medication vial and place other patients at risk of infection.
Well, you're right. Thanks for explaining those issues. I would never want to do something that places patients at risk.
No problem. We're glad to have you here on your rotation, but before you do any procedures, you should review our infection control policies and procedures, which incorporate CDC guidelines.
Some healthcare providers may have heard about the outbreaks due to syringe reuse and assumed they were all caused by reusing syringes or needles from patient to patient. In reality, many were due to contamination of medication vials that were used for multiple patients. All healthcare providers must understand the risk of reusing syringes or needles to access medication vials. It is best not to take multi-dose vials into patient treatment areas unless they will be dedicated to a single patient. Multi-dose vials that are used for more than one patient should be prepared and kept outside patient treatment areas. Whenever possible, multi-dose vials should be dedicated to a single patient to provide an extra layer of protection. Remember, injection safety is every provider's responsibility.